Good afternoon, everyone, or good morning, depending where you're joining us from. We are still rapidly admitting everyone, so I'm sure people will join as we start. But yeah, it's a good time to get started. So, welcome everybody to our webinar on working with the Thrive by 5 Index 2024. My name is Dr. Kaylee Cook, and I am from DataDrive, and I will be your host for our webinar today. So, first, some housekeeping. Some virtual housekeeping. Please keep yourself on mute to avoid any surprise guest speakers. We do have a meeting format, so we are asking you to be responsible for yourself and keeping yourself on mute. Throughout, questions are welcome, so please drop them in the Q&A box as we go. If we don't get to answer your question live, we will do our best to follow up down the line. So for those who are new to the Thrive by 5 Index or who haven't or hearing about it for the first time, the Thrive by 5 Index is led by the South African Department of Basic Education and coordinated by DataDrive 2030. And it is the largest survey of preschool child outcomes in South Africa. And we are here today to announce the launch of this open access dataset and to get a taster of what can be achieved with this data through the presentations from our working paper series. But first, let me take you through some of the details of the Thrive by 5 Index. The 2024 index had three main research questions. The first one, are young children in South Africa on track for their age at the point of entry into school? Now, this research question has already been answered for 2024. And for those who are really interested and want to know, you can hop over onto the Thrive by 5 website and see the results for that research question. But that's not what this webinar is about today. The next two research questions are, how do the characteristics of the child, their household, and their early learning program impact learning outcomes? And what are the priority actions we need to take to ensure that more children thrive by 5? We've only just started answering these questions, some of which is available on the Thrive by 5 website in some of our main report documents. And the researchers you will hear from today uncover additional insights into the responses to these research questions. But our hope is that by making this data set open access to anyone, that we can uncover even more crucial insights in helping to answer these really important questions about early childhood development. So a little bit about this data set. For the final sample in this data set included 5,001 4-year-old children in 1,388 early learning programs across the country, a nationally representative data set of children enrolled in early learning programs in the country. We also had a small sub-study of non-enrolled children that you will hear about in one of our presentations today. For each child in this nationally representative data set, we have information on their learning outcomes, their approaches to tasks, physical growth, social behavior, emotional readiness, skills and attitudes of their teachers, the quality of their learning program, the caregiver characteristics, early health, and home learning activities. A really rich, comprehensive data set of South Africa's 4-year-olds. So what is the working paper series? Well, at the end of the 2024 data collection, researchers were invited to apply for early access to the dataset to investigate and explore research questions of interest. And what emerged is 7 papers that you'll hear about today, spanning topics from climate stress and caregiver mental health to policy impacts, cognitive development, machine learning prediction, and positive deviance. Now, you might be thinking, I have some research questions that I think this dataset could answer. Well, like I said, lucky for you, this dataset is now open access and can be found on the DataFirst website, and we will take you through how to find that dataset at the end of this webinar. So a quick agenda for what you will be hearing and seeing today. There will be 7 lightning talks. The full papers of each will be available on the DataDrive 2030 website very soon. We'll hopefully have time for 1 to 2 questions immediately after each talk. There will be time for additional Q&A with the speakers and the Thrive by 5 team. Just a reminder here to please use the Q&A box when listing these questions. And then at the very end, we will have a tutorial on where to find the dataset on DataFirst. So without further ado, our first 3 speakers today cover topics related to risk and vulnerability for children's learning outcomes. And I'd like to invite our first speaker, Matthias, to present his paper on early learning under climate stress. Go ahead, Matthias.
Okay, thank you so much, Kaylee. Let me go ahead and share my screen. Um, all right. So first of all, let me thank everybody for coming. My name is Mateus. I'm currently a PhD candidate at the Stanford Center on Early Childhood, and today I'm going to present the working paper called "Early Learning Under Climate Stress: Extreme Rainfall and Child Development in South Africa." And this work is co-authored by DataDrive's own Kaylee Cook, as well as my two mentors and advisors, John Lombardi and Philip Fisher. Let's start by talking a little bit about the research question itself, and it has to do with climate change. As you know, climate change is making extreme weather events more common and more intense. And one particular extreme weather event that is being more and more impactful in South Africa is extreme rainfall. As you can see from those images on the left-hand side of the slide here, in the last few years, South Africa has experienced a lot of flooding and extreme rain, something that wasn't really that common before climate change. And in this context, it's very important for researchers and policymakers to investigate not only what kinds of effects climate change has on society at large, but also whether exposure to extreme rainfall during early learning, right, that critical developmental period affect young children's development. And then if so, who does it affect more, right? If it is the case that there is an effect, we want to know which kids are more at risk so we can intervene and build resilience accordingly. So the methods that we use to answer these questions, on the exposure side, we're looking at how many days of extreme rainfall a given child experienced at ages 3 and 4. We get high resolution satellite data from every early learning program in South Africa, and we calculate more or less how much rainfall those children experience. And then we look at ELOM scores. I'm not gonna spend too much time talking about the early learning measurement tool. This is all in the main report. You can look for it yourself. But here we're looking at early learning measures, particularly numeracy, literacy, cognition and executive functioning, as well as the social emotional functioning scale. And then lastly, we also wanted to look at differential impact, right? As I said, it's important to really get a sense of who is it, which kids are experiencing those vulnerabilities more strongly. So we look at differential impact by family SES, by ELP fees, right? How expensive a learning program is. And lastly, municipal level multiple deprivation, which is a more kind of structural indicator of socioeconomic status. Here are our findings. So you can see this graph here that represents the predicted levels of cognitive cognition and executive function, as well as literacy. And what we see is that more exposure to extreme rainfall does lead to challenges in both of these outcomes. But very importantly, it's not the case that any exposure to extreme rainfall leads to challenges. As you can see here on the very left, if a child has an expected amount, they're actually doing fine. They're doing great. And even if they have 2 times as much expected rainfall as they were supposed to have, they're still on average doing okay. It's really when we see 4 times as much expected rainfall. So those very, very common and much more intense than usual extreme rainfall events that have been caused by climate change, this is when we start seeing challenges. And then the panel on the right shows that it also widens socioeconomic inequalities. So, for example, if you see this graph over here, centers with higher ELP fees versus lower fees, the difference between them is much greater on high levels of extreme rainfall. So the difference here on the right is really big, and the difference on the left is not as big. Same for multiple deprivation. The difference between high socioeconomic is really exposed to a lot of rainfall, but not so big when they're not. So the applications are, first, we have to keep building resilience in early learning programs and homes through infrastructure and flexibility. There's been a lot of push for frameworks that work in that direction, such as the Nurturing Camp framework, but we have to make sure that these incorporate climate change risk as well. Second, future research has to keep doing more fine-grained measurement, and we have to look at mechanisms of impact, right? So why is this effect happening? Is it because kids are not attending learning programs anymore? Is it because they're getting sick more often, or their family is getting sick more often? Or is it because their family finances are suffering, for example, because their livelihoods are not working anymore? So our key takeaway here is that kids' cognitive and emotional development is affected by extreme rainfall, but this is not deterministic, right? We can build resilience and we must do so to protect against those risks. Thank you very much for your attention.
Thank you so much, Matthias.
Thank you, Matthias. Thanks very much. A reminder to everyone that questions in the Q&A box. If you're struggling to find it, on the bottom of your screen, you'll see a circle with 2 dots in it with the label more. If you click on that, it'll take you to the Q&A box. We'll be monitoring questions that get posted in this Q&A box. Please don't put the questions in the chat. And then after each presentation, we'll have an opportunity to answer 1 or 2 key questions. I don't see any questions in the box at the moment, but please feel free to add them if you think of any. Thank you, Matthias. Thanks very much. And of course, all of the details of these papers, as well as contact details of the authors, will be made available afterwards, so you can always follow up with additional questions. Okay, Kaylee, I'll hand back to you for the next presenter.
Great. Yeah, thanks, Matthias. Really interesting findings. I'm sure climate change is on everyone's mind. So great to see it entering the early childhood development space. If there are questions about the paper, please still pop it in. We can always bring it up and ask Matthias a bit later. So the next paper is, I'm inviting Johanni and Anati to present their paper on caregiver mental health risk and child learning outcomes. Please go ahead and share your screen.
Thank you so much, Kaylee. I hope everyone can see my screen. I am Dr. Johanni Beerkes. I'm from the SAMRC WITS Developmental Pathways for Health Research Unit at WITS. I will be presenting with my co-author, Anati. She will be introducing herself a little bit later in our presentation. So let me start. Let me just move this, sorry. Here we go. So early childhood is one of the most important periods of human development. During the first 5 years, children develop the cognitive, social, and emotional foundations that shape their future learning and well-being. However, these developmental processes, as you may know, do not occur in isolation, and they are strongly influenced by the caregiving environment. Now, in South Africa, many caregivers face significant pressures, including poverty, food insecurity, unstable environment, and limited social support. And these structural stresses are closely linked to risks for poor caregiver mental health, which can then affect caregivers' ability to provide consistent, responsive, and stimulating interactions with their young children. Despite this problem, large-scale national data linking caregiver well-being and early learning outcomes in South Africa remain limited. So our study therefore asked a simple but important question, which was, how are household and caregiver conditions that are associated with caregiver mental health risk related to early learning outcomes in young South African children? So conceptually, this study is guided by I just saw something there. By a bioecological framework where child development is shaped for multiple interacting systems. So we focus on how structural household conditions such as assets and employment may influence caregiver well-being, which then in turn shape children's early learning outcomes. So because the data set does not include clinical mental health measures, we used proxy indicators. This included food insecurity, perceived social support, and caregiver functional difficulties, which are strongly linked to caregiver psychological well-being. We analyzed data from the nationally representative Thrive by 5 index, including over 3,800 children aged 4 to 5 years. We then used a multivariable regression analysis, which allowed us to examine multiple factors together and identify which ones are independently associated with children's early learning outcomes. Here, I'll give over to Anati.
Thank you, Yohani. Hi, everyone, and thank you for joining. So my name is Anati Kwinana. I'm a South African clinical psychologist, but I'm currently a PhD candidate at the University of Cambridge. So I'll take you through the key findings as well as the implications and limitations. So just starting off, the model explained about 12% of the variance in total scores, with structural factors dominating. So higher household asset scores were strongly associated with better learning outcomes, which was in line really with previous research that demonstrated that household resources were strong predictors of early learning outcomes. And it reflected the advantages of economic stability as well as access to resources, enabling early learning engagement. So just looking at the child characteristics, these really also stood out in matter. So older children performed better, reflecting the developmental gains. Although it was quite a narrow range, I think it still reflected these. And boys were found to perform poorer than girls, which is consistent really to results from the 2021 survey. And this may maybe suggest that boys are more vulnerable to early developmental risks and particularly socioeconomic adversity as well as household stress. So caregiver employment status was also negatively associated with ELIM scores. However, I think this warrants a more cautious interpretation, maybe further exploration, as in like low resource settings, caregiver employment can be associated with more precarious and time intensive work, which may limit caregiver availability to responsive interactions rather than really reflecting economic stability or security. So, although food security and perceived social support in the correlational studies demonstrated associations to the ILUM scores, these were weak and they became insignificant once they were controlled for socioeconomic status. So I think this highlights the importance really of multivariate modeling when examining caregiver environments than relying on correlation analyses alone. Next slide, please. Thanks. Okay, well, I think the attenuation of like several bivariate relationships in the multivariate models really highlights the need for more rigorous modeling that accounts for the overlapping in socioeconomic and relational influences. So perhaps future research should explore more mediating mechanisms. An example of this may be looking at caregiver stress regulation to better sort of understand caregiver education and resources and how these translate to developmental gains. And at a more practice or policy level, the results reinforce the importance of addressing structural economic inequalities as a pathway to really improving early learning outcomes. So interventions that strengthen household economic stability and reduce caregiving strain may indirectly support well-being and children's developmental outcomes. And given that we observed sex differences, and these were found also in the previous study, I think early interventions may need to particularly be attentive to the developmental needs of boys, especially in resource-constrained settings. And in as much as the study included the use of a large nationally representative data set, I think there were a few limitations. The first one being that the cross-sectional design really prevents a causal inference, and it might be helpful to have more longitudinal studies that also explore developmental trajectories over time. And secondly, the absence of standardized caregiver mental health measures forced us to use proxies, but I think it limited our ability to directly link caregiver psychosocial symptoms with childhood outcomes. So maybe future research can include these in the data collection stage, allowing it to be viewed more directly. Okay, thank you.
Thank you
Great.
both. Okay. Thank you both for the presentation. And there's a question actually that Erica asked for Matthias, which I actually think so Erica asked, how do climate-related shocks increase gender-specific risks for young children, including disruptions to care, protection, and early learning? And are there gender-responsive approaches that are needed within the ECD systems to mitigate these risks? So I think it would be great, Matthias, if you could answer this question, and then perhaps Nati, you might respond as well through a gender lens, whether you looked at any of these findings from a gender perspective. Matthias, do you want to start?
Sure. Thank you so much, Sonia. This is a really good question.
You're on mute,
We did
Matthias. Can
not.
you unmute?
Am I? I thought I think I'm. Can
We can
everybody
hear
hear
you
me?
now.
Oh, okay. So we did not look at gender specifically as a moderator. This is a really good question, actually, and a potential avenue for future research to see if these effects differ by gender, and then if so, why, right? Is it that families maybe protect boys versus girls more? I think there's a lot of interesting pathways to look at there. The only thing I can say is that we control for gender in our analysis. So the effects that you see are averaged out across genders. So we can pretty safely say that it's present for both genders. We just don't know if they differ, if there is a strengthening of the effect for boys or for girls. But it's a great question and very, very promising for our future work.
Thanks, Matthias. Anati, do you want to respond on whether you looked at the gender lens? Nati?
Sorry, my network seems to be acting up. Trusted to do this when there's a presentation, but I think it requires a bit more exploring, really, to sort of look at the more nuanced things that are happening within the household and looking at how girls versus boys are maybe raised and how they are supported within households and outside of that to give a more to get a better understanding of the type of support that they would need. So it would be hard right now to really say how they can be supported, but I think it would require greater exploration. I don't know if you want to add, Hani.
Yeah, no, thanks very much. And then I think also just to respond, there was another question around whether children were assessed from different geographic areas. Absolutely, it was a nationally representative sample. And in the map that Kaylee showed earlier, you can see the little blue dots that each represents an early learning program. And you can see it's really widely spread across the country. It included rural and urban children. And children are assessed in their mother tongue, language that they're most familiar with. And that's a really important part of this. And all of that information is in the technical manual, which is available on the Thrive by 5 website. I also just wanted to comment that on the shortcomings of it being a kind of a cross-sectional study, and just to say that we are actually planning some longitudinal work, which is very exciting. And so watch the space. As we do that, of course, more data will become available, and as always, will be made open access. So thanks. Kaylee?
Great, thanks so much. Two good starts. All right, we're going to move over to Mashaba, who's going to focus in on numeracy and literacy skills for us. So Mashaba, please go ahead and share your screen.
Hello, everyone. I hope you can see my screen. Great. Okay. Hi. I'm so glad to be here. Thanks for the opportunity. I'm going to share some of our findings that we had related to the determinants of school readiness in South African preschoolers. I'm Mustafa Sultanlu, and I'm assistant professor at UCL in the UK, and also associate researcher at the University of Johannesburg in South Africa. All right, let's start with the research questions. We were interested in knowing which factors would determine school readiness in the sense of numeracy and literacy in South African preschoolers. So you may ask, why numeracy and literacy? And here are some reasons. So first, numeracy and literacy are considered to be the gateways to school learning. What does that mean? It means that without being literate or numerate, we literally cannot learn anything at school. So these are like two kind of gateways through the education at the school entry. The second point is we are kind of at the age of AI. So those skills are very fundamental for dealing with those fast changing words. And also, I need to mention that South Africa is not really doing so well when we look at international surveys. For example, if we look at TIMSS, less than 20% of South African children are performing in mathematics at the age and level of education that they are supposed to. Very similar pattern is observed when we look at Pearl's data, for example, regarding reading ability and literacy. Again, below 20% are performing at the stage, at the level that they are supposed to. So this seems to be a very critical issue at very early on. So, as you may know better than me, we can look at those potential determinants at different levels or layers. So we can look at them at the child level, at the home and family level, school level, and also community level. So in this project, in this study, we looked at these three layers to see how they would predict the performance of the children. The previous speakers, they already mentioned, so that helped me to go quickly through the analysis that we conducted. So we conducted a mixed multivariate logistic regression, and we looked at those three layers, how they would predict being on track or not being on track, or doing well or not well in numeracy and literacy. And indeed, this analysis will tell us the contribution of each predictors in being on track or not being on track for numeracy and literacy after controlling for or adjusting for all other predictors. So here is our finding. So the way that we can look at each of those predictors, so I gave an example here that the way that we can go through them. So let's briefly walk together here. So at the child level, we see there is quite a bit of share between the predictors for being on track for numeracy and literacy. Especially, we can highlight fine motor skills, cognition or executive function, emotion functioning, and attention to the task. But of course, at this level, we had some differences between the predictors for numeracy and literacy. So for example, sex and age were the predictors for being on track or doing well for literacy, but not for numeracy. And vice versa is true for the gross motor. Going to the next step or next level, well, the same level, but next category, let's say home and family, indeed, they did not contribute at all on children's performance to being on track for any of those two. So that surprised us. So we did a couple of follow-up analyses. So one of them was excluding those variables at the child level. So we thought they may suppress the predictability of them. But after excluding them, still none of them was a predictor, which put a big question mark here for us. Going to school or early learning programs, they contributed a little bit to each of those. So actually for literacy, curriculum planning contributed, but climate, like school or classroom climate, had a negative, actually unexpectedly effect on numeracy. And putting all together, in the end, those predictors could only predict 26% of being on track for numeracy and about 25% of. So there's a lot of variance probably here hidden somewhere or somewhere else that we did not measure that we need to further dig into to see. So what does that show us? So at the child level, we can first say that children are doing actually their best. Though, as again, the previous speaker mentioned, it's a cross-sectional data. So we should be a little bit careful about those causal relationships. Looking at home and family, a recent UNESCO Global Education report said about 70% of South African parents are worried about their contribution in their children's education. It seems that the parents are kind of aware of their lack of contribution. So here we can come in and provide training for parents through social media, ECD centers, and a variety of other ways. Going further to schools, again, I want to refer to the UNESCO report that came last year out. It says there is no alignment in curricula, in textbooks, teacher's guide, and assessment. So maybe we need, this is a place that we can contribute. So we need maybe revisit those materials to align them. And on top of that, to have regular training for practitioners online or offline and assess their knowledge and their performance. With that, I would like to thank you for your attention. It was, I just presented the work of this great team that I had the opportunity to work with them. So if there's any questions or comments, I'm happy to take.
Thanks, Mutaba. Thank you very much. Mutaba is going to be presenting the full scope of his paper at a webinar, an upcoming webinar, and we'll share details of that with everyone on this call. So there were a couple of questions here. Question from Andrew, Mutaba, is the findings that you have around the variables that looked at home and family and having no effect on numeracy and literacy outcomes. Is there comparable research from elsewhere in the world that either supports or contradicts this? Would you like to take that question?
Yeah, so that's a very good question. So yes, there is actually. So home activities and the contribution of the parents is a big line of research in early childhood, and there are a lot of studies showing to a very good degrees they contribute to children's preparation or readiness for the school entry. So yeah, we do have a lot of studies, though I have to mention that most of those studies are not necessarily super huge, like this study, right? And most of them conduct univariate analysis. This is another issue. So we conducted univariate as well. When you do univariate, all the predictors are significantly predicting. But this is not the very appropriate way to look at this data. So we need to do multivariate. And when we do multivariate, we adjust for all other predictors. So, and when we do multivariate, most of them are gone.
Okay, thanks. So what I'm hearing is that there are multiple factors here potentially, including what was measured, how we measure it, as well as how the analysis is done and what's controlled for. And that can make comparison across studies a little complicated.
Absolutely.
So thanks, Mutaba. I know there are additional questions, but just I think in the interest of time, we're going to move on to the next presenter. We have allowed 10 minutes at the end. And if there is that time, then we will come back to some of these earlier questions. Thanks, Kim.
Great, thanks so much. All right, on to our next two presentations, which are going to be around policy and impact. So I'm going to invite Grace to go ahead and share her screen.
Fantastic, thanks, Kelly.
Let me share the right PowerPoint presentation. Great. So thanks, everyone. It's great to be here on the call this afternoon. I'm Dr. Grace Leach. I work for the National Treasury of South Africa in public finance, and I'm looking today at the role of the government subsidization program. So the role of government subsidies in the early learning sector in South Africa. And I'm going to be fairly quick. So the key question that we're looking at here is really just the fact that equitable access to quality early learning is a core goal, if not the core goal, for the Department of Basic Education in their effort to provide services, ECD services in South Africa. And government subsidization of registered ELPs is the primary policy mechanism for improving the provision of ECD services. There are some other policy mechanisms, but it is of huge focus. It's the biggest fiscal provider of finances in the sector. So it's a key policy mechanism. And this paper therefore looks at the role of subsidization in achieving the dual goals of access and quality. And in the context, have people looked at this before? Yes, but there is no strong evidence which directly quantifies the causal impact of government subsidies on early learning outcomes. So it's a bit of a sparse academic literature. The methodology that I used multiple, some didn't make it into the paper. I used descriptive stats, really interesting just to look at relationships descriptively. Then I analyzed the role of the subsidy in removing barriers to access via ordinal regression analysis, which allowed me to see the effect of receiving a subsidy on whether or not an ELP principal waives fee payment. It was a fascinating exercise. Next, I looked at the relationship between subsidy receipt and child outcomes. So I first estimated a baseline regression using a normal weighted ordinary least squares regression. As previous people have said, it was multivariate. I usually employ multivariate, so I forgot that on the slide. But then I extended the specification to replace the binary subsidy receipt, so binary being either receives or does not receive, and I replaced it with an ordinal variable. So I distinguished between not receiving the subsidy, receiving the subsidy but not on time, and then receiving the subsidy on time, to test whether or not the timeliness of subsidy disbursement would moderate the effect of subsidies on child outcomes. Just to note that more technical detail, as well as literature review and context, can be found in the working paper. So first, a note on some of the key relationships between quintile or fee group, subsidy receipts, and child learning, early learning outcomes. So this really surprised me, is that in your lower fee groups, quintile 1 low, 1 high, and quintile 2, we are not seeing a huge difference between those children who are unsubsidized and those children who are subsidized. So this graph shows the highest mark, the lowest mark, and the median mark. And it shows that it's fairly flat over here, and only really in quintile 3 and 4 do we start to see that children who are in subsidized centers have a higher average ELOM outcome. And the relationship kind of breaks down in quintile 5, but I think that's because of very small sample sizes. But so I tried as hard as I could to fit a propensity score matching on this, but because it's just a very interesting thing that we're seeing in reality, but I think there are some answers as to why we see this. So the key findings is that even with an eroded subsidy value of 17 Rand at the time of the data collection in 2024, subsidy receipt is associated with a statistically significantly higher likelihood of waived monthly parental fee payment by principals in the lowest fee band. So what does that mean? In the lowest fee band, a principal who is receiving subsidies is more likely to allow children to come without their parents paying monthly fees. So she's more likely to waive the monthly fee payment. And this is a major reduction in the barriers to access for the most vulnerable children. Secondly, In this study, we see that subsidy receipt does not have a significant association with ELAM 4 and 5 scores. This is not surprising, given that subsidy receipt is targeted to your poorer places. But there is a tentative positive association between subsidy receipt and ELAM 4 and 5 scores in higher quintiles, specifically quintile 3 and 4. And here I go into a little bit more detail in the paper, but why I think this is the case. And really what I think we're seeing is that there's some threshold of finances really, below which we're not going to see much of an impact. So centers that are operating below a certain threshold of income, I would be fascinated to do more research to know what that is. But subsidies that are operating below that threshold, even if they receive a subsidy, it won't push them into a threshold where we can really see improved child learning outcomes. And so there's a huge argument to be made about really looking at the whole package of support that sites receive. It also suggests that there are multiple other factors which are required to scaffold early learning in a center, that money alone is not really the be-all and end-all of improving quality. And lastly, I found that when subsidies are not paid on time, learning outcomes become more dependent on household socioeconomic status. That is to say, when funding sources are not reliable, the children in those centers end up being more reliant on their home background because the provision of care may be unreliable, or meals are late, or I think it's a very practical thing. And really is to say that we need to be protecting children in the most vulnerable settings, and that it is crucial for subsidies to be paid on time, especially for subsidies being paid to low socioeconomic statuses. So what does this research mean? First, I want to give a limitation that since the subsidy is targeted toward poor children, and because poverty, weaker learning outcomes, poor child health, lower home socioeconomic status, etc., are all related, it's very difficult to see the true effect of the subsidy because we don't see the counterfactual. We can't see how a child would have been had they not received the subsidy versus that exact child when they do receive the subsidy. But I think that I expected this limitation to cause some difficulties in the paper. But there are some important implications. Firstly, the government subsidy plays an important role in removing barriers to accessing early learning, especially for vulnerable children. And I think as someone in public finance myself, it's important to realize that the subsidy does play a role in access. Secondly, the government subsidy alone may not be sufficient to improve quality. That is, other inputs are needed alongside funding. I think the sector is aware of this, that while money is needed to buy resources, and it is certainly a needed input, there are other important inputs such as training, process quality, etc. And the third implication is that the government subsidy must be administered reliably and on time to improve outcomes for children coming from the poorest homes. And I think this will greatly improve early learning outcomes because we know that subsidies are not always paid reliably. And that's it from me. I want to thank you for your attention.
Grace, thank you so much for a really engaging and stimulating presentation. I'm going to suggest that we move on to Jessel's presentation because I think the two presentations are really complementary, and then we'll open up for questions after that. Please remember, guys, to put your questions into the Q&A box. You can find that box on the bottom of your screen. There's a circle with 3 little dots. Click on that and you'll find the Q&A and pop your questions in there. And then we'll come to questions for Grace and Jessel after the next presentation.
Go for it, Jessel. Thank you.
Thanks. Good afternoon, everyone. I'm Jessel Kika. I'm a PhD student with RESEP at Stellenbosch University. And my presentation title for today is Does Enrollment in Early Learning Programs Improve Child Cognitive Outcomes? And this is evidence from 3 South African provinces. So to give you some context, and this is sort of alluding to what Grace was talking about, South Africa has made strides in expanding access to ELPs, but we still see that nearly a third of 4-year-old children are excluded. These non-enrolled children are also disproportionately from poorer and more vulnerable households. And as government now goes forward and advances this 2030 strategy for ECD programs, expanding access to quality programs is a central policy objective. So the two questions that I'm going to touch on today are firstly, one is enrollment in an early learning program associated with measurable cognitive differences among children from disadvantaged backgrounds? And secondly, under what conditions do these enrollment advantages emerge? So as Kaylee mentioned, what's been really exciting about this version of the Thrive data is that we now have information on non-enrolled children. So the Thrive data collected information on 272 children. So this is the sub-study sample. And data was collected on these children who were based in 3 provinces, so KZN, Gauteng, and the Western Cape. And these children were also in the bottom 3 weighted school quintiles, so they are more disadvantaged relative to those in the top 2 quintiles. And the question we really want to ask here is, what would ELOM outcomes look like for this specific group of children if they were enrolled in an ELP? And also just to mention that the 272 children are not nationally or provincially representative. So now when we're doing this comparison, it's for a very specific group of children. So what I then did was I used coarsened exact matching to match this group of non-enrolled children to not enrolled children who have the same characteristics. So I matched them on age and gender, and this is because it accounts for the developmental stages, the determinants of ELOM performance, and it also ensures some within gender comparison. I matched them on province, so I'm matching a child in Gauteng to a child in Gauteng, for example. And I also matched them on primary caregiver education, and this was my proxy for household socioeconomic status and the home learning environment. So just to give you a quick example, I matched a female non-enrolled child who is, say, 52 months in KZN, whose primary caregiver does not have a matric, to the exact same child in an enrolled sample. And I also accounted for things like the primary caregiver's relationship to the child, the language of assessment, some of the household characteristics, and additional home learning environment characteristics in my regressions. So what did I find? When I just looked at these two groups, I saw a gap of 5.8 ELOM points between the two of them. And this is around 5 to 6 months of maturation. But then when I started breaking it down by the quality of the ELP that the enrolled children were in, the story becomes a little bit different. So this figure shows us the gap between non-enrolled children and enrolled children. And that's why this gap is negative. It's non-enrolled minus enrolled. And the red line means that there's 0 difference between the two groups. So if the little confidence interval line overlaps with the red line, it means that it's not statistically significant. So what we see is that across the structural components, so things like our registration status, subsidy receipt, infrastructure, practitioner qualifications, we see that non-enrolled children score significantly lower than enrolled children. So this means that enrollment is working when we're looking at all of these structural characteristics. But the pattern changes slightly when we bring in instructional quality, and this was based on the LPQA tool that was administered. So we see that when children are in ELPs with inadequate instructional quality, the enrollment gap is around 2.6 ELOM points. It's small and it's statistically insignificant. And then in contrast, when they have basic or good instructional quality, this gap becomes larger and statistically significant. So we're seeing this gap between 7 and 9 ELOM points now. But what's also important to note is that even though the numbers for good look a little smaller than basic, that difference is not significant. So what it's actually saying here is that the difference is not between basic and good, but it's being in an ELP with inadequate instructional quality compared to being in one that has at least a basic level of instructional quality. So the main finding of this is that enrollment in an ELP translates into gains in cognitive outcomes only when instructional quality meets at least a basic standard. So if it's inadequate, enrolled children perform no better than comparable children who are not enrolled. And now these results, again, are very specific to this group of children. So if we had perhaps a nationally or provincially representative group, these results could look different. And we couldn't see any causal impacts here that could be generalized to the wider population. The sub-study sample is small, it's not provincially or nationally representative. And while this matching strategy reduced some of the observed differences between the enrolled and non-enrolled children, we still may see some unobserved selection into enrollment, and we can't rule that out. And same again, like some of the other speakers, the cross-sectional design limits some of our claims about the long-term sustained effects of enrollment. Thank you very much.
Thank you, Jessel. Thank you so much. That's such fascinating and critically important work. Really, really important. We know we have an access gap of more than 1 million children aged 3 to 5 that are not enrolled or attending an early learning program. And this data really provides us with the evidence we need to support attendance, but not only attendance and enrollment, but also highlighting the importance of having basic quality in that. So thank you so much. We don't actually have the questions yet specifically for you and Grace, but there are 3 themes that seem to be emerging from the comments and some of the other questions that have come up. So I just wanted to quickly touch on those, and feel free for the rest of you to kind of put questions in related to this. But so the first is there's some questions around longitudinal, and Lorata asked a question around how would we follow up on these children, because they would have moved out of preschools when we came to do a follow-up round. And just to say that we are working with the Department of Basic Education to see whether it's possible to track these children into and through the education system, so that we can actually look longitudinally at every round of the Thrive by 5 index, at every cohort, if we're able to track them through the education system. And that's how we're thinking longitudinally. The second thing is there was a question around the early learning programs that were included in the Thrive sample. So we did include playgroups in the sample. I think that was one of the questions. We included any group learning program that had at least one child between the ages of 50 and 59 months and that operated for at least 8 hours a week. So it really was open to programs beyond just the formal ECD centers. And then the third thing I just wanted to acknowledge is there's a lot of interest in the chat around parent engagement, parent interest. I think that time permitting at the end, we can come back to that, but I think there's definitely a lot of work to do there. And as somebody pointed out in the comments, what we found in the Thrive by 5 index, the main report, was that parents' perceptions of how well their children were doing were often mismatched with their children's actual learning outcomes. And so I think thinking about ways to engage more effectively with parents is really key. So yeah, thanks, Kaylee. I'll hand back over to you and just remind people to please pop their questions in the Q&A box.
Great, thanks so much. And yeah, always great to see lots of engagement in the chat. So our final 2 presentations are some really new and novel and exciting methods to look at ways to identify positive deviance and just ways to identify what makes some children thrive and some children not. So with no further ado, I'd like to invite Michelle to please share with us her talk on machine learning prediction of school readiness. Michelle, you can go ahead and share. I think Jessel, you need to just unshare yours.
Thank you, everyone. Good afternoon. My name is Dr. Michelle Leal from the SA-MRC WITS Developmental Pathways for Health Research unit. And this presentation looks at whether or not machine learning could predict early learning status among preschool children exposed to socioeconomic or growth-related adversity. Sorry, can you see my screen? Yeah, you can. Sorry, I didn't start the presentation. There we go. Okay. And this matters because, sorry, I skipped ahead. This matters because broad national averages can hide which children may need support most. Globally, around 250 million children under 5 in low and middle income countries are not reaching their developmental potential. In South Africa, fewer than half of children aged 4 or 5 years were on track for both growth and early learning. So the question in this study was, within a higher risk group, which child, caregiver, and program indicators best distinguished children who were on track for early learning, and what information might be most useful for identifying children who may need additional support? The analysis used the 2024 Thrive by 5 Index. The full data set included 5,001 children across 1,388 programs. But for this study, the sample was restricted to 2,278 children aged 50 to 59 months who met the study definition of adversity. The outcome was whether or not a child was on track for early learning using the ELOM 4 and 5. Predictors came from 3 domains: child, caregiver, and household, as well as program factors. The information used to define the outcomes. Outcome was not included as a predictor. So we used 3 models to compare whether or not machine learning can predict early learning outcomes. We use the elastic net logistic regression, which is a strong but simple benchmark, and the histogram gradient boosting, which is more flexible and allows for more complex patterns. And then the mixture of experts neural network, which allows for different pathways for different children. And to evaluate the performance of the models fairly, the data were divided into 5 groups of centers. In each round, models were trained on 4 groups and tested on the 5th. So they were always evaluated on centers not used in that round of training. The main finding is that information useful for prediction was concentrated in a relatively small number of variables. As you can see in the figure, child age in months was by far the strongest contributor, even within the narrow range of 50 to 59 months. Other important variables came mainly from the child and the home context, including home language, caregiver-rated child development compared with peers, storytelling or reading, and the number of children's books in the home. Growth-related disadvantage also mattered. Children who were on track were less likely to be stunted than children who were not. And program variables were added less extra predictive information than the child and the caregiver factors. And the same pattern was seen when child, caregiver, and program information were tested separately. This means that the approach is more useful for identifying risk patterns across groups or prioritizing further assessment than for making decisions about individual children on its own. In the dataset, the most useful information for identifying and prioritizing children for additional assessment or support came mainly from the child and the caregiver context. These implications have practical implications. These findings have practical implications. For implementers, routinely collected child and caregiver information may help prioritize additional developmental assessment or support. For policymakers, program indicators on their own might not be enough if the goal is to identify which children are most likely to need help. And for researchers, it may be important to examine which program measures add useful information once child and household disadvantage is already taken into account. Of course, there are also limitations. As mentioned before, this is a cross-sectional study, so we cannot establish causality. The model performance was modest, so it cannot be used for individual prediction. Validation was internal only, and caregiver data were missing for about 1/4 of the children. It also may have been difficult to separate program effects from child and household disadvantage in this data set. But the main takeaway from the study is among preschool children exposed to adversity, routinely collected child and caregiver information may help identify children which are more likely to need additional developmental assessment or support. Thank you.
Thank you very much, Michelle. Thank you. I'm hoping that everyone's joined the webinar is getting a sense of the varied and rich investigation that can be done with the dataset. Grace, there's actually a question here for you from Gabby. Her question is that she's saying in previous work they found strong linkages between subsidies and structural quality within early learning programs. And she's wondering whether you've effectively controlled for differences in the background characteristics of children who are attending subsidized versus non-subsidized early learning programs.
Thanks, Sonia, and thanks, Gabby. I was also surprised with this results. I will admit that I tried everything. And I think the thing that I kept coming up to was that once you controlled for fee band, and I tried also with priority zone, but once you control for fee band, LPQA and subsidy receipt, the LPQA and the structural quality predicted the child outcomes, but the subsidy was no longer significant. So there was a link between subsidization and improved quality, but it didn't come through consistently and significantly in the models that I used. Perhaps I should try again. But I didn't sort of feel like I had a consistent result that I could show, because there is certainly a link between LPQA and structural quality and ELOM, but there was nothing sort of significant coming all the way through. But thanks. I'll take another look. I'll try again.
Thanks, Grace. And then, Michelle, there's a question for you as well for the modeling work that you did. Would it be possible to standardize ELOM scores by age so that you can back out the impact of age and pick up maybe other factors more clearly? Because age obviously was a really dominant factor in that analysis. So that's the question for you from Gabby. Michelle, that question was for you. You need to unmute, please. Unmute.
Sorry,
Thanks,
my
Michelle.
connection dropped for a second, so I missed the question. Could you repeat it, please?
Yeah, the question was whether you could standardize ELOM scores by age so that it wasn't such a dominant factor and you could start to tease out some of the other factors, contributing factors.
That's a good question. I didn't standardize by age as perhaps something to look for in the next round or next further research. I tried to just use the raw data set, as it is, to see if it can pick up patterns among the children. So yeah, that's a good question, and thank you for bringing that to my attention.
Great. Okay, thanks. As you can see, there's lots more work to do. So these are really, really helpful prompts. Kaylee, back to you.
Thanks. All right, on to our last speaker. Janita, can you please share your screen?
Hi, everyone. It's such a joy to be with you this morning for me. I'm Janita Henry, and I am a PhD student at Harvard, and my collaborator is Amy Hare from Data Drive 2030. So today we're looking at the characteristics of exceptional early learning programs, or ELPs. So traditionally we look at this from a risk factor or traditional deficit lens, where we look at poverty and stunting and what holds children back. But today we're looking at a positive deviance lens, which is where we're trying to identify statistical anomalies in the data in low resource settings, so where children are doing exceptionally well relative to their peers. And this is important for South Africa, where roughly 60% of ELPs are charging less than 350 Rand per month, or the equivalent of $21 US. To answer these questions, we conducted a 4-step procedure. So first, we identified correlates of ELOM and socio-emotional functioning scores using XGBoost, which is a data-driven method, and as well as theory. Second, we did multi-level models and statistically controlled for non-intervenable child characteristics to estimate what can be explained by the ELP. And we find that roughly a third of the variation in scores can be explained by ELPs, which is a lot of variation. And then third, we identified positive deviant ELPs, which is the top 15%, so the 85th percentile, and tagged them as either PD or non-PD. And then from this, we found that only 2.5% of ELPs were jointly ELOM PD and socio-emotional functioning PDs, which suggests that there might be something distinct happening at these ELPs. And then finally, we used a range of models and samples to identify robust correlates of these PD ELPs relative to non-PD ELPs. So I'll separate the findings into ELOM and SEF. So for ELOM, we find that practitioners who viewed play as entertainment or socialization rather than a formal teaching tool had a higher odds of being a PD facility or ELP. And then the second thing is around governance. So having formal employment contracts or maintaining child support grant information was important. And then alongside the first finding of practitioner play philosophy, we find that practitioners who have a more instruction-oriented view had a lower odds of being a PDELP. And then we also find various program quality assessment domains, such as language and literacy, acknowledging effort, and child-to-child interactions. And then we find negative associations for staff engagement, numeracy and maths, and behavior management. For SEF, we find a few different variables. So being either fully or partially registered with the Department of Basic Education, having multiple languages of learning and teaching, having a culture of respect in the ELP, and this is measured by agreement between practitioner and principals, being in an ELP that is founded by the principal and providing a morning snack, and then also a range of divergent and LPQA domains. So for example, high scores on the group quality domain were associated with PD ELPs, whereas indoor play materials had a lower odds of being PD ELPs. We also find some convergent variables across both of them. So particularly The child independence domain in program quality was positively associated with both ELOM and socio-emotional functioning PDELPs, curriculums that include support materials, and then interestingly, principals who have a more instructionally oriented view rather than a play-oriented view were positively associated with positive deviance facilities. So this suggests that there could be some role differentiation between the principal and the practitioner on their views or philosophies on play. We find across both outcomes that being open during the school holidays had a lower odds of being a PD facility. And then we find that principals who have at least an NQF level 6, so they have higher formal accreditation, had lower odds of being in a PDLP. But for this variable, we find in the ELOM outcome, using a composite training score, there were positives. So there might be implications for what we're measuring in terms of training and qualifications. Importantly, we also find divergent signals across some quality domains and variables. So for example, daily schedules was positive in one, but negative in another. And then we find that socio-emotional functioning is less tied to play philosophies of practitioners or principals. So the implications for this is that first, there's not really one size fits all. ELOM and SEF have distinct profiles. So we need greater evidence for SEF measurement. We note here that it's teacher reported, and others have also mentioned the cross-sectional nature of the data. So the longitudinal data would really be amazing. And then for principals, we could be looking at more practical ECD leadership capacities rather than formal accreditation. We find role differences in play philosophy by practitioner and principals. And then finally, there is some administrative formalization indicators that show high consistent associations. And it could be that these might be necessary conditions. So in summary, we find that exceptional ELPs are not associated with accumulation of physical resources, but by good governance and management, the championing of child autonomy, and practitioner beliefs in exploratory play. Thank you.
Thanks very much, Anita. And something which maybe just to share with everyone is we applied a positive deviance lens to the first round of the Tripartite Index 2, the 2021 round. So this is the second one. So it's really building on that work. So thank you so much. Denita, there's one question here around, which I think you've partly answered, but I don't know if you want to talk in a little bit more detail, is looking at the extent to which early learning programs that develop agency in children, whether there's an association between that and positive deviance.
Yeah, I think the child, Kaylee might be able to answer this too. The child independence LPQA domain would be a good indicator of child agency and autonomy. And so that's really a strong correlate of both ELOM and socio-emotional functioning PDs.
Yeah, I can maybe add to that. The child independence is really looking at if the classroom environment and the teachers are enabling the child to be independent, and you find in centers where that is encouraged, where children can pour their own water and fetch their own lunch and things like that, that children obviously then display higher levels of independence. So it's more of is the classroom climate and the teachers enabling that in children.
Okay, I think that's all the time we have for questions. So I'll hand over to Kaylee now, and then Ty's going to take us through the dataset.
Great, thank you so much, everyone. This has been an incredible display of what some incredible academics and researchers can do with a really rich and comprehensive data sets. And like I said, I think this is just the start, and we hope to create communities around this. and see more papers coming out in collaborations, and knowing that a 2027 round is also coming, the potential of longitudinal data. So we're really excited about what's to come in the next few years. So please keep in touch with us. I'm going to share, I'm going to let Ty share his screen now, and he's actually going to take us through exactly how to find this data set on DataFirst if you want to download it and use it yourself. So go ahead, Ty.
Hey everyone. Yeah, so as Katie said, I'm going to walk you through how to access and start working with the Thrive by 5 index dataset. You access it through the DataFirst data repository, which is associated with the University of Cape Town. So you can Google it. You can also just Google Thrive by 5 2024, and it's one of the top search results. Thrive by 5 2024 dataset, and it's one of the first top results on Google search. Note that there's also a link directly to this dataset accessible from the Thrive by 5 websites. So that link will come up very soon. But before I go into this, I'd just like to take a quick moment to mention a colleague of ours, Zenzi Patla, who sadly passed away this week. She was instrumental in generating this dataset, and she was an absolute pleasure to work with. She always brought smiles to the office, and I'm happy that she has this Thrive by 5 dataset as part of her legacy. So so once you've landed on the opening page, you go to Get Data, and you click here Open Data, and it should take you to this, and then you can click Visit Our Data Portal. And because this dataset's just been added, it's one of the latest additions, so you see it right at the top of the screen. But you can also just search for it in this box over here, Thrive by 5, and it will come up, and search for it and it'll come up. I'll just click here. Okay, so on this portal, there's a couple of tabs that are important. There's first the dataset description. So on this dataset description, it just gives background information about the study itself. It provides an abstract. It provides information about the coverage, so where the study was conducted. It distinguishes between the enrolled and the non-enrolled children. It gives some information about the sampling, the weighting, the instruments that were used, and the data collection period. So this just provides some background information. Then the second tab is the data description, and this is like the data dictionary. So if you click on any of these, it'll give you the names of the variables that were part of the several instruments that were used in the Thrive by 5 2024 study. So I first clicked on the LPQA, which is the Learning Program Quality Assessment. Clicking on it opens up the different variables. It gives a label, and if you click on this, it gives you some information about the variable itself. So what kind of variable it is, and any additional labels, like value labels associated with those variables. Then on the next page, we got the downloads. So this page gives a bunch of different documents related to the study. One that's very useful for any analyst is the instruments themselves. So the instruments were conducted using Survey CTO. So you can download the instruments in PDF format and read through them. Along with the PDFs is a guide on how to understand some of the Survey CTO specific functions that you might find in those PDFs. So that just makes it a bit clearer. We included the reports. We included a data merging guide, so some guidance on how to merge the different data sets together. So the ENOM 4 and 5 is the centerpiece, but then you might want to add variables from the LPQA to the Thrive by 5 data. This data merge guide provides guidance on how to do that. Then it also provides an important guide on sampling. The sampling weight guide, because it's a nationally representative sample, we included weights, And this guideline, which you can download, just provides some information on how to apply those weights. And we give some practical examples for both Stata and R. Then lastly, to mention is the data dictionary. So I mentioned this data dictionary over here in the data description. There's a downloadable data dictionary that comes out as an Excel file. Then to actually get the data, you would click this last tab over here, Get Microdata, and there'll be if you click the download zip button over here, the data will be downloaded to your computer. It will probably ask, unless you already have an account with DataFirst, you'll be asked to sign in or sign up. After you've done that, you'll get the data downloaded onto your computer as a zipped folder, and then you can start analyzing.
Great. Thank you so much, Ty. I hope that gives everyone an idea of all of the documents that we really put out there to try and help people use the data set, and just really excited to see what comes out of this. So I've just got one more slide to share before we close off. All right, so as we said, the full papers from all the researchers you heard today will be available on the Data Drive 2030 website. They're not up just yet, but they will be made available very, very soon. And that will be under our News and Opportunities tab on the Data Drive 2030 website. And we'll put the corresponding authors, and so hopefully this will encourage some engagement, potential future collaborations, and just general work together as a collective who are passionate about driving early childhood development. I have lost my screen share.
Thanks, Eli.
Yeah, thanks. Then furthermore, this recording will be made available on our Data Drive's YouTube channel. So if you have some colleagues who missed this, who really wanted to see this, or you want to remind yourself about what one of the papers said, this will become available on the YouTube, our YouTube link. So please go ahead and check that out. And these 7 papers are really only scratching the surface of what this data set can tell us. And we really encourage you to download and engage with the data sets, and let's continue our collective learning about early childhood in South Africa. So for more information about the Thrive by 5 Index in general, as we've said multiple times, you can go straight to the Thrive by 5 website. There is a link straight to the data set from there, as well as all the technical documents. If you maybe were unfamiliar with what ELOM was and you kept hearing that word, this website will tell you exactly what the ELOM is in our technical documents. And if you have any specific questions about accessing the data set, we have an email address, data@thriveby5.co.za. You're welcome to send us an email with any questions about the data set, trouble accessing it. Please reach out to us on that email address. So thank you so much, everyone, for spending your afternoon or morning, early morning, Mateus, apologies, with us. This was a really engaging session, and I hope everyone has a lovely day further. Thank you so much.
Thank you so much, Kaylee.